Hello, this is Dr. Bob and Debbie DeMaria. Welcome once again to the Half Off Health program. And tonight, as always, we are going to bring you some information that I know, if you really pay attention, will change your life. Are you ready, Deb?
I am ready, Dr. Bob, and I'm very excited because as I look, we have a limited amount of props tonight in comparison to where we usually go. So where are we going?
Well, Deb, you know it's so fascinating. We have been involved in natural health care personally when I started my training 1974. That was before VHS tapes. That was before cell phones and the internet. There's a lot of people that are watching us right now that weren't even born yet.
Right.
That was like the whole other millennium.
Right. Well, even computer.
I know, it's so phenomenal. But what's so amazing to me is what we're going to talk about tonight is the basics. You know, gravity continually and relentlessly pushes down on top of us. And we have so much technology today. They are creating stem cell tissues. They have a drug for everything. They can replace almost any joint inside of your body. But when it comes down to the reality of life, it's very simple. Now pay attention. Your brain sets in the skull. The brain continues on inside of the spine. The spine is made of 24 movable parts. That means the spine can move. The spinal cord, which Debbie is going to hold for me right now, is analogous to your printer cable. And I'm kind of chuckling, Debbie, because we have a printer right now that's wireless.
Right.
So there'll be a time that we won't even have these cords anymore. So this cord, this printer cable, is inside of your spine. We know that the spinal cord is very important because it's encased in bone. Now watch this, because we have patients that come into our office all the time. I recently had a young lady came into the office that was involved, now listen, in a motor vehicle accident 13 years ago. So when somebody comes into our office, we always look at their posture, Deb. So let's say this is the left side right now. So let's say that you would get hit from the side in your motor vehicle and your head goes this way and back this way and then backwards. That's what a whole whiplash is. Well, over time, if somebody comes in, and I notice when we do the postural assessment and their head is shifting off to this side, chances are they have misalignment and or subluxation below that area that oftentimes is caused by trauma. Soccer, so they do this with their heads, you know, soccer, playing football. You watch how much trauma today. They're talking about these guys that are dying. Even cheerleaders, when they jump off the ground or off of a mount onto a ground or falling off of your bicycle, causes the spine to go out of alignment, creating subluxation that stops your body from functioning.
So what does that mean, Dr. Bob? Stops my body from functioning. How do I relate that to maybe a bowel issue, that I have something going on? Maybe I'm constipated or I have diarrhea or even indigestion.
You know, Debbie, it's a basic principle. Your brain, which sits in the skull, are you ready for this? Sends out 28 billion, that's bravo, billion emails every day telling the body what to do. So your brain is constantly sending information, assessing information, sending the information. So let's say that the colon is right down here. Well, we know that that message will go down here to the first lumbar vertebra. So this part of the spine is called the cervical, this is called the thoracic, and this is called the lumbar part of the spine. Well, the first lumbar vertebra has the responsibility of sending messages to the colon. And oftentimes, Deb, we'll find individuals that might be firefighters, nurses' aides, work at manufacturing plants that require bending, twisting, and lifting, causes this particular vertebra. So when somebody comes in with that occupation, that's a cue to me that they may have decay in that area. Decay is when the bone itself starts to settle down and the disc starts to deteriorate, putting pressure on the sensitive nerves that actually go to the colon. Deb, it's not uncommon for us to have someone come into the office, have been constipated. I know this might sound silly, for 30 years
Wow.
I know it's a long time. That's a lot of poop. Anyways, but what they're doing is they're taking a laxative to trick the nervous system. Let me, there's so many things. I'm just thinking about all the stuff I could be telling everybody right now. So your brain sends a message down. You were raking leaves, shoveling snow, putting mulch on the yard, doing whatever, washing your car, and you irritated that particular vertebra right there. You might not think about it, but you maybe notice your bowels aren't functioning optimally, or you have a little diarrhea, or we could take it up a little bit higher and you have a subluxation at your thoracic or your mid-back vertebra, and you have digestive distress. You don't put the two together. So this goes on, Deb, not only for a week, but maybe a month or a year. You start to live with your problem. You start to live with the challenge. You go to your healthcare provider. You say, I'm having this challenge. I don't know what's going on. They don't think about asking you what you were doing at the time, like I fell off the back porch and I injured my spine. Because, see, if this is out of alignment, your colon's not going to work. So you'll go to your healthcare provider, and all due respect to them, they're not informed on necessarily the significance of the nervous system. The nervous system controls the function of your body. So if there's misalignment there and your colon's not functioning, they may make the decision to send you for a test. They put the colonoscopy up your rectum, or they send something down your throat. They notice you may have some inflammation, so they write a prescription for the symptoms to manage the symptoms of your body not functioning, because the switch is off, let's just say, to your colon. What's so fascinating, Deb, is that you could have a switch off anywhere in the body. And if you have a switch, so if you wouldn't mind handing me that model right there.
I won't.
Now what this model is that this is the first vertebra in the spine, and then this is the second vertebra in the spine, okay?
Okay.
So this is a big version of that. So what I want everybody to see is your spinal cord literally is right inside of here. So if we're looking at the spine from the side, and let's say we have somebody that comes into our office, Deb, that head is in the forward position like this. So if somebody comes in and their head is like this, what's happening is that their spinal cord, their spinal column is going forward and literally choking the nerves. But this is the second vertebra right here in the neck. I know from my experience that this vertebra, when I take an x-ray, so when you make the wise choice to come into our office as a new patient, that vertebra, this second vertebra, should be flat, and this one should be angling at 30 degrees. If you come into the office and that vertebra is tipping down, let's say at a minus 10 or 20 degrees, I know the ramifications is that vertebra is subluxated, affecting the nerve, Deb, that goes to your sinuses.
Wow. Or any other part of your body, Dr. Bob.
Main switch for that particular spot right there for that one. But you're right, Deb. That whole body below that can get squeezed.
Wow. You know what, Dr. Bob? I think that right now I want to show them a couple visuals. And part of it is going to be group participation. So if you're there with other people in the room watching television, what I want you to do is listen very closely. We're going to go through a few exercises because we want you to participate with us so you can see the importance of what a chiropractic does for your everyday life. Now, if you're there by yourself, don't worry. Take these notes down, and when you're with somebody, I want you to do that. But there are a few things you're going to do by yourself anyway. The first one, Dr. Bob, is they can take the wrist of somebody, and what you want to do is you want to gently squeeze it tight and put pressure on their wrist area. I've got one hand twisting one way and the other hand twisting the other way.
You're enjoying this, aren't you?
Oh, Dr. Bob, please. If you would think about it, after a period of time, his hand, his fingers are going to start to tingle. Actually, they're going to change color.
They are.
They are, because they're not getting the source from what they need, the blood flow, the source, the energy from the rest of what the messages are coming to tell the fingers what to do. So in turn, the subluxation is like this crunch part right here with my hands. It's turning off the correct flow to, for example, your finger area, and that's what's going to start first. Well, what's really interesting is you're going to get symptoms. So whether it be your finger tingling or whether it be I didn't go to the bathroom today, or whether it be I had some indigestion after I ate. All of those are symptoms of something deeper. Now, before I go into the next one, do you want to add anything on there, Dr. Bob?
Well, I think what's so important that we want to go almost all the way back to the beginning of the program and say this. When God breathed life into Adam, he breathed life, spirit. Your body has the ability to heal itself. So if you make the wise choice to come into our office to have an assessment, Dr. Bob and our team, we don't heal you. We turn the vertebra back on, the messages back on, so your body has the innate ability to heal itself. So healing, now listen, so profound, and what separates what medicine does and what chiropractic is. Your body heals from the inside out. Would you say, Dr. Bob? Your body heals from the inside out. When you take an antibiotic, that's outside in healing. Your body has the ability to create wellness itself. We just have to eliminate interference. And as a side note, Deb, and I don't mean to throw your thought pattern off, I've been getting more and more research that they've been saying if a child has a fever or a cold or an ear infection, guess what you're supposed to do? Nothing. Let it go for 2 or 3 days. And right now, if you're listening to us and you have a chronic cough and you think you have pneumonia, viral pneumonia is not going to be impacted by taking a drug. Now, bacterial pneumonia, which means you probably have a temperature, is a little bit different and serious. So you have to be logical in the amount of medications that you're putting in your body. But Debbie, what also is so significant today, and this is why you and I are so involved in food, if you eat conventional food, that means not organic food, you're eating food that has chemicals in it, even antibiotics. And that's their concern today. We're exposed to so many chemicals and drugs, Deb.
You know what, Dr. Bob, we are, and that makes a big difference in how we run and take care of our life. And you know, we have so much more. Yes, we have that participation part of the program that we want to go back to, so you yourself can see how your spine really is. We're going to take a short break. Call someone on the phone. Tell them to be watching us, and we'll be right back.